an introduction. So, firstly, I'm going to talk about these things. So, my name's Lindsay. I am, I finished my master's actually at Tel Aviv University last year. Currently, I'm doing a thesis in the field of disaster management. I'm studying corruption within humanitarian aid, which is not strictly speaking related to this at all. But to go over specifically why I'm giving this talk, as part of my master's education, I was accepted into a fellowship at the university called the Irwin Cotler Fellowship, where we met on Sundays, most Sundays throughout the year, and we talked about Israel and democracy, Jewish history, human rights, things of that nature. So it mostly involved was like a discussion-based group, but we did also go on some field trips to learn about practical things like in person as well. And this talk that I'm giving is kind of like the final requirement as what I've agreed to do as part of that fellowship. That being said, they gave us total free reign in terms of what we could talk about and who we could talk about it to. So in this, I think that this is a really important topic, and I hope that by you guys kind of coming here and listening to this talk today, that you'll get both a better idea of like what anti-Semitism means, what it looks like today, because it has sort of shifted, I would say, what it looks like in healthcare, particularly how it impacts the healthcare sector, and then also again, like what can we do about that? So ultimately, what I'm hoping is that we can have kind of a productive discussion, or I can give you guys new things to think about. That's sort of what I'm hoping we can gain today from this. So, firstly, I'll start with a definition of anti-Semitism because I think that's important because sometimes I think we might think that we understand something, but having a definition can help us kind of clarify what it means kind of in our minds and also in practice. So, this particular definition is from the International Holocaust Remembrance Alliance, and it says anti-Semitism is a certain perception of Jews which may be expressed as hatreds towards Jews. Rhetorical and physical manifestations of anti-Semitism are directed toward Jewish or non-Jewish individuals and or their property, towards Jewish community institutions and religious facilities. So what I like about this definition is that it's talking about the idea that this can be something uh, physical, that can be something maybe that we would think of as being more familiar with, like, say, for example, the usage of slurs or kind of defacing of, Jewish community institutions or synagogues, things like that. But I also like that it talks about the rhetorical idea, the idea that anti-Semitism is more than just these kind of physical outward manifestations of things. They can also be kind of ingrained in the way that people think about Jews in particular. So I like this definition because it talks about kind of the dual elements there, and it also includes the idea that anti-Semitism isn't strictly speaking necessarily always just directed toward people who are Jewish. You can also be a non-Jewish person and experience anti-Semitism, which I think is important as well. I think that's kind of an underappreciated facet of this. So now I'm going to talk about kind of historical uh, historical understandings or historical ways that anti-Semitism presented itself and how we can still see that happening today, but in a slightly different way. Because, like I said, I think people in some regards can understand what a physical manifestation of anti-Semitism looks like, but there might be other aspects of this phenomenon that aren't really understood unless, I don't know, you are experiencing it or more aware of it or something like that. So I think that this will help us going forward to understand how things have shifted. over time. Uh, there are a lot of images here. They might make you uncomfortable. Truthfully, they are uncomfortable to look at. But again, that's part of why we're here is we have to look at these things we have to face them in order to be able to do something about it. So here I will start with one of the more uh, common ones, shall we say. All of these images that I am using for these pictures, by the way, are from this Anti-Semitic Imagery and Caricatures article that talks about them more in depth if you're at all curious to look into that sort of thing. So in this image, in the one on the left, you can see it's an octopus who's encircling the globe, kind of slimy, and it's a Jewish octopus because there's the Star of David above its head. And then that is kind of the trope that the person that drew this is using is the idea that there's an idea that Jewish people have some kind of secret world domination or world control kind of thing that they're trying to achieve as some kind of collective. Now this is quite old. I think this is from I think it's from the 1950s. I can't remember exactly. The one on the right is much newer. You can see this time, the person whose head is on this octopus is George Soros. He's like a European businessman who is Jewish. And again, it's the exact same imagery and the same kind of understanding with this exact thing, this idea that George Soros is kind of manipulating world politics, the world stage, etc., for some kind of nefarious means. So that's quite a common stereotype that we see. Uh, Similar to this is again this slightly different. It's the idea of like Jewish kind of puppet master here in the left photo. Again, this one's old. This one I think is from the 1930s. You have a Jewish man, and he's being a puppet master to all of these people below. And then again, this newer one. In this picture, there's a bigger puppet master, which is the Rothschilds. They're a famous um, Jewish family that's in modern day quite wealthy. They're involved in banking and real estate and all kinds of different things, and that has kind of uh, prompted some people to, uh, say that they're like a hand behind the wheel, so to speak. And in this image, you can see that they're the bigger hand that's controlling George Soros, and George Soros is controlling military leaders and stuff like that. So again, this same trope of, you know, years and years ago, before World War II, and in some ways even before that, is we're seeing a resurgence of that now. It's kind of people have adapted this to modern day. This is another big one, and probably the biggest kind of misconception, and it's responsible for what we call blood libel. It's the idea that the Jews were responsible for killing Jesus, which has been a source of a lot of anti-Semitic issues, especially among like religious communities. So this left one is from Poland from 1943. Obviously, there's Jesus, and then there's a Jewish person the implication is that, the Jews were responsible for killing Jesus. The one on the right is a newer one, not to get too overtly political, but this one is from a pro-Palestinian protest, and this is an example of anti-Semitism directly in that kind of movement where it's an image of Jesus carrying the cross, and it says, "Don't let them do the same thing today again." So again, this very old anti-Semitic trope that is patently false, but that gives people, I would say, an excuse, an outlet to be anti-Semitic is then being repurposed in the modern day, in the modern kind of political sphere. Uh, Along a similar vein, this is a very old one. This one goes back even to medieval times. I mean, the one about Jesus is also quite old. But this one is the idea that Jews are somehow involved in devil worship, or like the killing of children, things like that. The one on the left is a wood carving from the 16th century, and it's a Jewish guy. There's a devil. He's doing some kind of magic, evil something. The middle one is a little bit older. The person whose face is supposed to be on this kind of devil creature is Ariel Sharon, who was a former prime minister of Israel. So again, kind of that conflation of Israel, Jewish people, and the devil or kind of evil. And then an even newer one here. And again, this one, it seems like based on what's in the background, is also from a pro-Palestinian protest. But this appears to be Biden as the devil. And again, we see kind of this conflation because it says the puppet master, the mastermind of all evil. So it's Biden with some horns, who is the responsible, apparently, according to this, for all of the bad things in the world. Oh, so, uh, again, I wanted to do this mostly to give you an idea of how I think sometimes people might think that these are things of the past, that maybe, post World War II, we had progressed past these kinds of things. But unfortunately, what we're seeing, what I will show you soon, is that we're seeing quite a resurgence of these ideas, both in kind of the population at large and also specifically in healthcare. The healthcare sector, these things are coming up, and it's really quite problematic. So to talk about some recent trends, um, the data here is from the Antisemitism Worldwide Report for 2024. It was published by the Irwin Cotler Institute, which is the institute through which I'm doing this fellowship. So they release this report yearly, tracking anti-Semitic incidents around the world. I pick Canada specifically, obviously, because that's where I'm from, where I'm most familiar with. And what it showed is that in general, there has been quite a big increase in anti-Semitic incidents worldwide, and especially in Canada. Canada only has a Jewish population of just under 400,000 people, the largest of which are in Montreal and Toronto. And we can see that from 2022 to 2023, we almost doubled, or more than doubled. Doubled. We doubled the amount of anti-Semitic uh, incidents. I will say that this graph is only referring to anti-Semitic incidents that were like reported to the police. So with that being said, it is also possible that there is an underreporting happening. Um, just to put that out there. And then we can see even that in 2024 it went up yet again. So it's continuing to increase as opposed to petering out or going down as we would expect. Um, and this has taken on a lot of, it's been, these kind of incidents are more so attacks on uh, overt symbols of Judaism, like synagogues, Jewish schools, or other Jewish institutions. Um, and in some cases, they're quite violent. For example, in May of 2024, there was an instance where two men fired shots at a Jewish girls' school in Toronto. Also in the same month, there was a case of arson at a Vancouver synagogue, which luckily only caused minor damage. And then in August, there was a coordinated instance of over 100 Jewish organizations, synagogues, and doctors who received bomb threats, which to my mind also suggests that's maybe not necessarily one person, kind of a coordinated effort, so more of a wider issue there. Um, this time, just to give you kind of so that we have more than one source here to kind of support this point that I'm making that anti-Semitism is increased. These are trends from a different study that was conducted among the American public, and it was looking at uh, the prevalence of anti-Semitism and anti-Jewish beliefs. Um, and it was this top graph here. They were giving people a series of anti-Semitic tropes and asking them to what extent they agreed with this. And we can see that in 1964, it was at its highest, where 29% of people were agreeing with six or more. And then there was quite a decline over time to quite a low in 2014 when it was only 9% of people. But then again, we see that in the last 2 years, we've had a sharp increase here, where as of last year, almost a quarter of the people surveyed said that yes, they agreed with six or more of these. And some examples of these tropes are things like, for example, Jews are more loyal to Israel than to America. 45% of the people surveyed either somewhat agreed or very strongly agreed with this sentiment. Or, for example, here, Jews have too much control and influence on Wall Street. Almost 25% of people were um, somewhat agreeing or mostly agreeing with that statement. And again, in that way, especially in this one about too much control and influence, we can see hints of those previous anti-Semitic stereotypes that I told you that have been around for a long time that are still continuing to surface and to resurface in some ways. What this study also found, interestingly, is that there was a correlation between people's likelihood to believe in conspiracies and their likelihood of holding anti-Jewish beliefs, which I guess is not so surprising when you consider that a lot of the kind of anti-Jewish beliefs tend to be along the lines of conspiracy theories. It's interesting in a way that I will touch on a little bit more later, or it has more significance than just that, but I'll touch on that a little bit later. And lastly, something I think is especially interesting is that this study found that these views were actually more prevalent among younger generations, which again might be the opposite of what people would expect. So this bottom graph here is showing the number of tropes on average endorsed by people of particular generations. We can see that baby boomers, contrary to what we might expect, hold on average, they agreed with like 3.1 of the tropes. Gen X, it's a little bit higher at 4.2. Millennials being the absolute highest at 5.4. So I think that's people around my age, like late 20s, early 30s, and then Gen Z at 5. Overall, though, quite an increase in the younger generation, which um, indicates kind of how these ideas are resurfacing and really taking hold in this generation of people, which is again, excuse me, not good. So, how does this all kind of tie in to healthcare? Because it might be easy to say, oh, well, that's kind of general, but like healthcare itself is pretty, kind of separate from these things. But actually, oops, what I found was that that is in fact not the case. So I'll talk about it in two parts, the first being patients and the second being practitioners. So in a recent article from Australia, it talked about sentiment among Jewish people that they were feeling the need to remove kind of visible symbols of their Judaism when accessing healthcare. On the right here are two symbols, one of which you're probably familiar with, which is the Star of David. People often wear it as a necklace. The one on the right is Chai. It's the Hebrew word for life. It's also a very common symbol that kind of Jewish people wear. And so people were talking about how they felt like they couldn't wear these things. They were afraid of, experiencing discrimination or reprisals of some kind when accessing healthcare. Another thing was also changing identifiable names. Some people were talking about how, in this article, they discussed how they actually decided to use their maiden name, which was less, in their words, kind of overtly Jewish, than their married name because they were worried about how they might be treated if they used their married name. Um, so that's obviously, we can imagine that this would have negative mental health impacts. Um, a study in Germany found that uh, anti-Semitism and experiencing anti-Semitism resulted in higher depression, anxiety, and then reduced social participation. The exception being among social participation of Jewish people among Jewish groups was actually higher, which I think also makes sense that you would kind of uh, group together with people that you felt were understanding of your experience and that obviously wouldn't treat you negatively. And this is also, there were earlier studies done that found that hiding Jewish identity led to feelings of self-hatred and guilt. And then, unsurprisingly, anti-Semitic experiences um, generally were associated with depression, guilt, and neuroticism, all of which I think are very understandable when we think of what that would be like, a feeling like you had to hide a part of yourself in order to just exist in the world, or you're actually experiencing people that hated you just because of who you are. Now for a focus on healthcare practitioners. This one I thought was surprising, truthfully, when I was reading about this. There was a survey done in the US that was looking at healthcare workers' experiences of anti-Semitism. I think they surveyed about 700 people, and they found that about 30% of them reported having witnessed or experienced anti-Semitism coming from colleagues. And that I think was a very odd thing because I don't know, that certainly hasn't been my experience working in healthcare, and I found it very kind of disparaging that it's really dispiriting that that has been people's experiences. Similarly, 14% almost reported the same, but instead of from colleagues, it was coming from patients. And you can only imagine how that would affect both of these things. Either if you were feeling like you were being discriminated against by your colleagues or by the people that you're supposed to be helping, the way that that would kind of negatively impact the relationships that you were having with these people. And then 26.4% reported feeling unsafe at work. An additional survey, again in the US, of healthcare workers, it looked at anti-Semitism in the workplace and online. So the online was interesting. It was a survey of social media posts made by people who were self-identified as healthcare providers. And they found, again, quite a large increase in the last, I think since October 7th of 2023, of these kind of anti-Semitic conspiracies popping up. So again, this idea of blood libel, this one being that Israel harvests organs and or blood from Palestinians. There was a big increase there. Uh, or again, this idea that European Jews are pursuing world domination. We saw a 1.9-fold increase. Um, and to me, I thought that was it was surprising to me. I didn't expect it to be that high for sure. Um, In the workplace, again, about 30% of people reported face-to-face anti-Semitic encounters. And in particular, this article mentioned an instance where an attending physician made anti-Semitic comments to a Jewish student while they were involved collectively in a patient encounter. And I think that says quite a lot about how acceptable that is kind of within a, like, not that it should be acceptable, but that it is accepted. Thus, a person would feel comfortable enough to make a comment like that in front of a patient, I think says a lot. Now I have some examples again, particularly from Canada. So the College of Surgeons and Physicians of Ontario published an article in 2022. So before we saw a big increase, shall we say, in kind of anti-Semitic trends, the article was about it was acknowledging the idea that yes, anti-Semitism and discrimination is a problem within the healthcare sector in Ontario, and we would like to do something about it. And this article was talking about people's experiences uh, of being a person who is Jewish and a doctor, and kind of how have they kind of navigated that? Like, have they felt the need to hide their identity? Things like that. And so the first one was the experience of a woman who's Israeli originally, and she moved to Canada, became a urologist, and she was saying that at some point early in her career, she made a decision not to wear, overt symbols of Judaism, and she said that she discloses it very kind of infrequently to her patients. So she described how sometimes when she does, she is very kind of disheartened by the response. And some of the reactions that she has gotten is, it's good that you don't look Jewish. Or one patient who actually didn't know that the doctor was Jewish, talked to her about the idea that Jews could not be trusted. Um, and again, to me, this is crazy. This is crazy that this is the reality of the world that we live in. Another doctor, also mentioned in the article, talked about how he had experienced in his long career several instances of patients not wanting to be treated by, and I quote, a Jew doctor. Um, so again, we can see that this is a prevalent issue within healthcare, both as an issue that affects patients and something that affects healthcare providers. Um, and then the last thing, because we might think, okay, that's an issue in general society, but universities are very liberal places. That definitely wouldn't be an issue there. We actually have uh, anti-Semitism within medical education. And I will say that in Canada in particular, this idea of anti-Semitism within medical education has a fairly long history actually, because it wasn't until 1951 that the first Jewish doctor got an actual full-time position at a hospital in Toronto. Previous to that, there were quotas on how many Jewish people would be allowed to study medicine in universities, things of that nature. So with that basis, not that far removed from um, our experiences today. And in particular, at UBC, recently, within the last few years, we had an incident where UBC physicians were found to be making posts on social media, which again, we're talking about these old tropes, kind of accusing Jews of being Christ killers, of organ trafficking. So again, that same kind of blood libel that we've seen for hundreds of years coming back again, even in modern day. And more recently, in 2024, 2005, there was an article that mentioned how there at UBC again, there was a petition circulated within the medical school, um, which argued that resident matching that occurs at like a later stage of medical school, that Jewish doctors should be banned from sitting on the panel that decides this process because of the possibility that they would be biased towards people, medical students who were Jewish. And there's also within this a refusal to actually recognize that this was an issue. Nearly one-third of the medical school students signed this petition, and the University of British Columbia refused to actually, acknowledge that this was an issue, at least according to this article. So, with all that in mind, we have to ask ourselves, what are the wider impacts of this? So I think quite an obvious one is lack of institutional trust, both as a person receiving healthcare and a person giving healthcare. If you don't trust that you're going to feel safe and protected at work, this is going to very much limit your trust in the place that you work, in kind of the wider systems that exist to protect you. And then, again, also fairly obviously, these would be severely damaging to both the kind of provider-patient relationship that healthcare practitioners and patients depend on for, kind of productive, positive experiences. And also, the relationship between colleagues would also be damaged. The last point here, spread of disease, is a bit more tangential, but this is where, like I said, we'll bring back in that idea of conspiracy theories and anti-Jewish beliefs. So, when the COVID pandemic was happening, to provide an example here, there were simultaneous conspiracy theories that the Jew, like Jewish people, had produced the coronavirus or caused it to happen. There was also distrust of vaccines because they were so-called like Jewish vaccines, or Jewish people were involved in the making of the vaccines. And to pull in a third one, that the entire pandemic, say, was orchestrated by Jewish people who were profiteering off the pandemic through, again, creating it, through creating the vaccines, through, I don't, through allegedly being able to control the world. Um, so this is kind of a strange thing that you might not expect, but that there could be, we could see, uh, kind of a spread of preventable diseases if there is a link that exists between people, not trusting vaccines and people not trusting Jewish people, and we see that they co-occur. Um, you can imagine that people would be potentially people that hold, anti-Semitic views would be less willing to take vaccines, so on and so forth. So that one is a bit more tangential, but I think really important because it very much demonstrates to me the kind of wide-reaching impacts that this can have. So, with all that said, what gaps exist? So firstly, lack of research, particularly in the healthcare field. Again, I mentioned some studies. This is not the most studied area, and it would be good to have more research into, what exactly the experiences are of healthcare providers or patients who are experiencing anti-Semitism, so that we can then address it. I think also a lack of acknowledgement, like I said, within various spheres, there seems to be a lack of acknowledgement that this is actually a problem. Same too with a lack of education about, what anti-Semitism is, how we can combat it, things of that nature. And also in particular, with lack of education, one of the studies that I mentioned earlier also looked at the inclusion of anti-Semitism within anti-bias training modules, and it found that most of the people surveyed felt or indicated that it had not specifically been included in their anti-bias training that they received at work, as opposed to, for example, racism generally or sexual harassment, things of that nature, which were specifically included. Anti-Semitism was not something that had been specifically included. So, how can we address this? So, firstly, what I think is important is to develop or utilize clear definitions of anti-Semitism, particularly in healthcare settings, to make it very clear what is acceptable and what is not, like what constitutes anti-Semitism, so that people have a solid collective understanding of that. Additionally, having specific policies for conduct, which most um, workplaces would already have. However, I think specifically outlining why anti-Semitism or like what are the penalties for being anti-Semitic, uh, within a healthcare or workplace or something like that, would be good for reducing its incidence. Also, mandatory education. I think that this includes also mandatory education kind of for people generally, but also um, education for healthcare providers specifically. And lastly, also the inclusion of anti-Semitism within anti-bias training is something that, again, the study has shown was something that people felt was lacking, that we should include to try and address this. And so, with that, what I wanted to say at the end of this is, having said all this, I recognize that anti-Semitism is kind of a far-reaching, problematic issue. And I'm not suggesting that, what we're going to do are going to be able to cure people of, you know, deeply rooted beliefs or anything like that. But I also don't think that we can't go on pretending that it's not an issue. And I think the best way that we can do that is to have these kinds of discussions, to talk about these sorts of things so that we can start to address the issue. And there is a quote by a Rabbi Tarfon who said, "It's not your duty to finish the work, but neither are you at liberty to neglect it." And I think that that is very much where I think we should all stand. It's not as if we're trying to say, one person, we're going to cure this whole issue, but we should very much strive to improve ourselves, improve the people around us, so that this hopefully is not so much of an issue going forward. Thank you. So that is my presentation. We have a few minutes. If anyone has any questions or anything like that, I'm